In this episode, we speak with Kristen Valdes, founder and CEO of b.well Connected Health, a platform that empowers consumers by unifying their health data and tools to take control of their healthcare journeys. Kristen is an award-winning leader and acknowledged visionary in digital health. She has dedicated her career to creating inventive solutions that drive the industry toward a more consumer-directed future. b.well's comprehensive platform serves providers, payers, pharmacies, and healthcare tech companies, supporting better care experiences for 150 million people through 60,000 consumer-mediated data connections and cutting-edge AI. I'm your host, RJ Lumba. We hope you enjoy the show. If you like the episode, click to follow.
RJ Lumba is the executive chairman of Market Insight Media and the managing partner of GrowthCap. He is the host of Great Entrepreneurs, a podcast for driven entrepreneurs and business owners. Our podcast covers all topics related to the entrepreneurial journey, from ideation to execution to optimization and to reaping the rewards of a well-run business. In the minutes ahead, we'll share with you unique insights and tactics from some of today's most accomplished and inspiring entrepreneurs.
Kristen, thank you so much for taking the time to chat with us today. It's a delight to be with you.
Oh, thanks so much for having me. I'm excited to be here.
So with many companies that we have on the podcast, we like to do, our fair share of research. And what stuck out to me was the profound meaning behind your mission. So I thought that would be a great place to start.
Yeah, no, I'm happy to share that. So, I've had the good fortune of being a healthcare executive my entire career. And it wasn't until I had my own children and was facing a health need with my daughter, my middle child, Bailey, who I've called B since the day she was born, who our company is named after, that I realized that the healthcare delivery system was failing the average American, that we did not have the tools that we needed to become participants in our own healthcare, and that we were oftentimes ignored and not listened to and just passed between the silos that really exist in healthcare. So in Bailey's story, from a very early age, she would just always seem to have health conditions or health issues, none of them super serious. But as she continued to evolve, one of the things that I recognized, having been in healthcare for a long time, was that there were too many oddities for her conditions not to be related. And so, it was around the age of 7 that Bailey had her first near fatal incident. And it was because 2 EHR systems couldn't talk to each other. So she was prescribed a routine medication for a sinus and ear infection from a pediatrician that was contraindicated to a diagnosis that was sitting in a specialist system that we had not been informed of, and where that specialist system did not provide a portal and had not met yet the compliance of things like meaningful use, where consumers and caregivers are now mandatorily given access to their healthcare information and data. So, I took all of the knowledge that I had growing up in my healthcare career, and I just said, man, I really think I know how to solve this problem. And so I set out on a learning year. And I just said, if I really wanted to create the tools that I felt that all people deserved to make their healthcare experience simpler and frictionless, and to give them the tools that they needed to advocate for their own loved ones and their families, what would need to happen? And that's when I learned that we would need to change the federal law. And so the same year that I launched b.well as an organization, just about a decade ago, I also joined as a director of an organization called the Caring Alliance. And the Caring Alliance is a phenomenal group of people. It's a private-public partnership that brings together big tech companies like Microsoft, Apple, and Google, big healthcare systems, big healthcare payers, and the federal government, HHS, ONC, CMS. And we are designed as an organization to come together to say, what are the transparent pieces of data that people need? And what are the federal mandates that we would need to create shoppability in healthcare? True transparency to individuals that allow them to have a seat at the table in their own healthcare. And that's how b.well was formed.
And it can be daunting. I mean, folks in corporate and being in healthcare and understanding all the complexities that come along with a heavily regulated industry, I would think it could be daunting, right, to then just say like, okay, I'm going to start my own health tech company. But your mission was so strong. Do you think that's what pulled you in that direction? Or did you always kind of have in you the desire to be an entrepreneur?
I tell people all the time, no, I did not have the desire to be an entrepreneur. I think I have an entrepreneurial attitude and spirit about me, but I like to be part of teams. And so the 2 companies that I worked for prior to launching b.well were both startup to scale up organizations. Although I'll be honest, I didn't know that at the time. I didn't join them because I was looking for a startup. I was offered roles with skill sets that I had that I found to be really fascinating. And I've always been very passionate about the work that I do. And so launching b.well was more around, did I have the ability to network and build skills that I could do things like fundraising that I'd never done on my own before? But one thing that I was very clear on is that earlier in my career, the companies I worked for went first in a lot of places. And so I was no stranger to modifying regulatory environments and regulations that governed things like Medicare Advantage and how Medicare Advantage plans got paid. My former role was one of the first private Medicare Advantage plans to launch in the country. And when things are new, you work with the administration and basically say, this is what's working, this is what's not working. And we were luckily part of demonstration years. So I knew, and it was always kind of inherent in me, that you never skirt a regulation. If there was an issue in the regulatory environment, the regulators absolutely want to hear from people, and they would rather change the rule for today's day and time and make it relevant versus have people figure out that or believe that they're stuck with that regulation and have to find really just obsolete ways around it. So luckily I had learned that early in my career. And so it didn't scare me to change the federal law and work with a team of smart people to figure out how to do that and get the data proof points to validate it. But for me, the entrepreneurial journey was, could I expand my skill set into things that I did not have experience with, where it was not my sole responsibility, because I was always an operator, to do things like, could I raise capital to start a business and to fund a business on the size and scale of what we would need, given that we're a platform company? And SaaS platform companies in healthcare that are true platforms, and I mean, like, you can build on top of them, with the vision that we had was so broad and so big. And quite frankly, there's just not a lot of capital partners that have the wherewithal or the stomach for the kind of burn that it takes to build new architectures, which is what healthcare desperately needs.
So there's two elements there that maybe you didn't have a lot of experience with. You mentioned the fundraising, the capital piece, and then I would think technology too. Like, can you recruit the right people in on the engineering side? So at that moment, you decide to go, and start your own company. What's the first thing you do? Do you immediately set out to raise capital?
Well, I think like all good operators, I started in the wrong place and I started with building a product.
Yes.
So, it's great. The painful lesson I had to learn very early was that if you're going to raise capital, the product's great. The problem and the fact that you can grow a business with buyers that can scale is not why most people start companies. They believe that there's a problem and they believe they know how to solve it and they're very passionate about it. So no matter how many people gave me advice that you're spending too much time on the product and the solution, and yeah, it's really great, people care about that, but what they care about more is, can you make this a business? I learned really slowly and painfully, like most first-time entrepreneurs. So I say all the time, there's a reason that capital partners invest in serial entrepreneurs, because the second time they can definitely do it faster and not take the kind of the slow road. But the advice that I give to all entrepreneurs moving forward, and I advise a lot of them, is find someone who went right before you in your space, get very close, and grab a mentor who can help guide you to, these are the things you should really focus your time, energy, and money on. So yeah, I would say where we started, even from a capital raising perspective, was we spent way too much time getting people to passionately agree that we had a problem that needed to be solved, which was actually not what was needed to raise the capital.
Yeah, I guess one could argue that going right to the product and spending time there, improving it in the marketing and getting customers in that then fund your overall business could be the right route to go. But I guess what I'm hearing is that this particular problem with healthcare technology requires a lot of capital and a lot of runway. So it was not feasible to go down the path of bootstrapping through clients.
No, it was definitely not. We were talking about changing the interoperability landscape as the foundation of the platform. And that meant that we had to change the architecture and we had to have the runway and the time to convince not only the legislators that they needed to push in. You have to remember, almost all of healthcare in the US, even today, is run on monolithic architectures. So we're going through not only our kind of digital transformation moment, but we can't get to our digital transformation moment like every other aspect of our care, which, we all walk around with smart computers in our hand. But if you think about it, the first screen mobile application you don't have is the one that manages your family's healthcare persistently, that you control and you decide where it goes. That's true even today. And so that's the part that we're changing. But in order to get to the digital era, we had to go through our internet era. We had to get people off of on-prem archaic monoliths and onto the cloud, which is a new thing that was unbudgeted for in healthcare margins. And we had to do that across the entire industry to make interoperability work. So we had to create new open standards technologies like the fast healthcare interoperability resources. We had to get people to adopt them. We had to go first and show people that the pipes work, that they are more private and more secure because there's so much concern over HIPAA and healthcare data and our most private assets. So I think we, like all entrepreneurs, were very optimistic that we could do it really quickly. And the truth is, the technology is very fast, but the adoption and the challenges to move an industry are very painfully slow.
Mm-hmm. And when we think about this digital health space, it seems like there's many players that are trying to solve different parts of the healthcare system. And so when I have these conversations with various digital health entrepreneurs, in my mind, I'm trying to think about where do they fit? Like in terms of what they solve, how is that different? Or is there a lot of overlap between these different solutions being offered in the market? And the desire really from an analytical person to in understanding the industry is to map it all out. Okay, which company sits where, what's their value proposition, who are their customers, et cetera. How would you explain where b.well sits in the overall system, and does it have a lot of competitors?
So, I mean, I think one, like all good companies, you have to have competitors or else you're not actually solving a problem that is well known, right? Digital health is a very broad category. And what I would say is that the challenge in healthcare is everyone uses the same pain points and problems, but their solutions are all very different. So it's very confusing for the healthcare industry to know who is the vendor that I need, what is the support that I need. I always like to tell people we do the really unsexy part of healthcare that nobody really wanted to spend the time and money to do, which is we re-architected the back end. So building native FHIR servers that can support bulk and individual exchange and exchange between payers, providers to providers, direct to consumer. And if you think about what healthcare really needs to become digital, data is the foundation because while healthcare is a service business, data is the product.
Mm-hmm.
Because if you don't know the person that is sitting before you in that service, you really can't service them well because no one gets all 100% of their healthcare in one location. It's impossible, right? You have labs, pharmacies, radiologies, you have primary care, you have specialties. Oftentimes you have home care and other, wearables and sensors and things that exist, plus all the properties and behavioral heuristics around you as an individual. So none of that can sit in one, kind of core system. So as we go through our cloud environment, one, we had to solve for data as the foundation, but then we had to put intelligence and AI on top of that to say, how do I basically create what an individual needs in a personalized manner? Because we're also changing healthcare from what I like to call kind of dropship marketing. So everyone needs a colorectal cancer screening the same month of the year. No, that's not true. How do we get to truly individualized healthcare where I can say, RJ, you're due for an updated tetanus booster. It's been about 10 years. It's a good idea for you to have it. Hey, do you want to go book an appointment with your primary care, or I can drop you into a neighborhood Walgreens pharmacy and you can get your tetanus booster tomorrow? What's most convenient for you? Kind of like your colorectal cancer screening. Do you want to go in and have a full colonoscopy? What is your family history state? Or can I send you an FDA approved fit test to your home? So being able to give consumers agency in their healthcare choices, we had to create algorithms where we knew the human well enough to say, these are the options that are available to you. And then we connect them from an access perspective to give them convenience and choice. So shoppability. I want healthcare to be as simple as going to Amazon to buy a red umbrella. You might get pages and pages and pages of options, but you get to decide what color, what length, what weight. Do you want Prime and fast delivery or do you not? Do you want a pattern? Do you not? What do you want to pay for it? What is the return policy? Do other people like that red umbrella? And we don't give that to people when they're searching for healthcare. And the sad but true fact is that over 90% of people, when they need a new doctor, just simply ask a friend. Mm-hmm. They don't know if that doctor is quality, if they're affordable. It's the only part of our lives that we have to consume a service before we know what it will cost us. But we have to consume it because healthcare is our vitality. So we're trying to change that and get to true shoppability.
Mm-hmm. The problem that you're really highlighting does sound very complicated to solve. There's so many different pieces to the equation of tracking each person's data across all these disparate databases, or as you refer to, monolithic systems. Where do you start and where are you now in terms of, because this is like, I don't know, multi-year, if not multi-decade process to get to the point where it's truly a seamless consumer experience. So where are you now? And maybe could you give us like a little bit of a roadmap?
Sure. So where we are now is over the last decade, we have made tremendous progress. So one, most consumers don't even know this yet, but everyone now has a fundamental right to access their healthcare data, their longitudinal healthcare record, through any trusted third-party application of their choosing. b.well just happens to be one of the oldest and largest trusted third parties. So accessing your medical record has become easier. Is it perfect? No, it's not perfect yet, but we can get the majority of people's healthcare information digitally in under 2 minutes time. And the hard part is not actually accessing the data. That takes a lot of time because we had to onboard as a trusted third party to every payer and provider and lab and pharmacy and Medicare and the VA, in the country. So we have hundreds of thousands of APIs that we transact in daily to be able to pull someone's record. But creating a longitudinal record on top of that is more complicated because you can imagine you might have lived at a different address when you were a child or when you saw this doctor versus that doctor. So identity management is something that we've been pushing as an industry forward using something like IAL2 credentialing, which is just a more advanced identity solution. We partnered with Clear, yes, the company at the airport. And we always like to say, like, if you can use your retina to board a plane from a TSA security perspective, you should be able to use your retina to collect your medical record. So, and I happen to have a child with rare disease, and she has 26 clinical patient portals. None of them are accurate. None of them talk to each other. So logging in 26 times is really burdensome. So we always like to say portalitis is the diagnosis we can eradicate in our lifetimes. So we're bringing newer technologies that are more secure into the fold to make things simpler and more frictionless to consumers. So accessing data right now, I would say we can instantly start to personalize healthcare insights, thousands of insights that can run directly on that data that can be matched to consumer facing content, and using omnichannel communications can get out to individuals through their healthcare providers, through text messaging, push notifications, email. And where we are from a roadmap perspective, and that we're very excited about, is we have our early partners that are now opening up APIs to access. And what I mean by access is, what are my options? What are the protocols and logic that sit on top of that to say, hey, if I need that tetanus booster, where can I get it? What's the earliest appointment time? Where you can decide it's most convenient for me to add this to my calendar, and you can book directly. So think Google Flights or Google Shopping. Right? If you go to Google Flights, you're going to see all of the airlines that can service you, what their costs are, what their schedules are, and you can either book through Google Flights or you can book directly with the airline. So think of that as the next place where frictionless convenience for consumers is going. So we have early partners. We power Samsung Health with longitudinal records and insights. And we announced last year that we are going to be basically taking a Walgreens pharmacy and putting it inside of native Samsung Health applications, so on Android devices across the country. And that means that when Samsung Health says, hey, RJ, it's time for your tetanus booster, they will be able to service you the closest Walgreens locations with the most immediate availability that you can book directly through Samsung. So we think about it as network, like a Google Flights.
Excellent. And as we're chatting, what's clear is that you have a mastery over data and information systems and highly technical proficiency. And I'm thinking, could an entrepreneur be able to do what you're doing without having that technical proficiency? And I don't think it's possible. You know it so well that you know the next steps to take on the product. Maybe if you could just share with us a little bit about your tech background.
Yeah, I mean, I will say I was raised in tech, but more on the data side in my career. So, everything from college degrees all the way through my earliest appointments. Definitely a data analyst by heart, but I have a very deep knowledge of policy. What I will say in healthcare, because we talked a little bit about the fact that we're going through our internet era and our digital transformation era, and very late compared to other industries that we experience, is that there is a little bit of a reckoning because healthcare is complicated for a lot of reasons. It is a highly regulated industry. While data itself is not as high transaction volume as something like financial services or credit card transactions, because you don't go to the doctor every day, right? But you tend to pay for something every day. It is voluminous in terms of the width and the unique codification of things like diagnostics and procedures and snowbed and loint codes and all these things that need to map together to make sense. And none of it was designed for human consumption. And we're not all trained as doctors, so we have to consumerize it at the same time. So from a tech perspective, I will say I have learned a ton from the engineers that we've had to bring on But we are going through a reckoning where the people with the most advanced healthcare subject matter expertise knowledge that came up through, I would say, like relational databases. So I can go to my engineers today, my cloud-based engineers, and I can say, hey, I'm going to talk to you like it's 15 years ago in a relational database, and I'm talking about a view, whatever terminology that is today, right, in the tech. I need you to translate that for me. And they're like, oh, you're talking about a composition. I'm like, great, I'm talking about a composition. Here's the fields, right, the information that needs to be contained. So you need to actually partner from an entrepreneur perspective, healthcare subject matter expertise, which you absolutely must have if you're going to go into healthcare in any way, shape, or form. But you're going to have to do a lot of education and training because today's engineers, the technologies they use, blow your mind. So I actually spent a couple of weeks ago vibe coding because why not, right? I mean, if anybody can do it, and I am a proof point that I can generate Python code on open standards that, can turn into designs and product roadmap features that can be faster and easily deployed. So I do think that the landscape of engineering is changing and product design is changing, but there is no substitute for a subject matter expertise because it is so complicated to work inside of the healthcare data. So I think what you're viewing as technical expertise is actually deep healthcare data expertise. And there are a lot of phenomenal people in this country that understand it deeply. I think what's really cool about the new regulatory environment. So we talked about the fact that consumers can now access their data through any trusted third party of their choosing. And I personally believe, and I know I'm not alone in this, but that the future of healthcare will be consumer consented and controlled. You as an individual will say, here's who I want to access my healthcare data. I will want the right to revoke. I will want limited sharing to the field level if I want to, of who gets what information. So I have a child with rare disease. I would want to volunteer our data, her data, my genetics, and others to anyone working in clinical trials, right? Because I want to know when my rare disease child could qualify for a clinical trial. That's my choice. And I think consumers will have the right to decide what they're doing with their healthcare data and what they want to contribute it to. Or if they just want the next doctor they're seeing to have their background longitudinal record so that they're informed when they're seeing. And nobody wants to fill out the form at the doctor's office when they walk in, right? We want to kill the clipboard. So it just convenience and friction. So what I would say is, as we think about this new entry into healthcare with these rights, big tech companies and direct to consumer retail organizations can now actually enter healthcare without having to sign a BAA and a contract for data rights, which before were what I call black boxes, right? Consumers never knew when those BAAs were being put in place and when their data was being shared for purposes. And so organizations like Samsung just came to the table being completely aligned with a consumer's basic rights. And they have, if you think about where consumers have today, 70% of us have a smart TV in our homes. What if you were, with a Samsung watch or a Samsung ring on your sleep, all of a sudden we detected AFib for the first time, or that you had an undiagnosed sleep apnea and you've never been evaluated for it. Imagine if you could talk to a physician or have a referral right there on your television. So if you think about Samsung's ingrained nature in the homes, healthcare happens the 99% of the time you're not at the doctor's office. So the fact that they came to us and said, look, we don't want to own someone's data, but we want to provide insights and we want to help people live healthier lives. And we want to help them with their wellness and their nutrition and their longevity. And we want to do it through all these smart devices that we have in the home and help people age gracefully at home. Then it became very synergistic that we could empower their new applications in health and all of their wearables and sensors with people's personal health data if a consumer chooses. And that's what allows them to get personal insights at scale, where you now have a concierge in your pocket that says, hey, RJ, you're due for that updated tetanus booster. Let us help you. Right? Or, hey, we noticed that, your heart rates are, irregular. We noticed that you don't in your history have a cardiologist. You may want to consider having an evaluation. Here are the people that are closest to you with the most available wait times. So being able to connect all of that just to make things simpler in your everyday life is what we're targeting. And so Samsung saw an opportunity not only for us to partner as a vendor, but we were so synergistically aligned that they came in as an investor and joined our board, which we're really excited about.
Excellent. Last two questions. One is, can you tell us about a person who has had a profound influence on you?
Yeah, and I'm going to say it's my daughter, Bailey. She is our Chief Inspiration Officer. We're very excited. She actually just graduated college and on time as a rare disease patient, which is really exciting for us. But she has lived, I would say, 1 million lives comparatively to the average person with what she's had to go through in her healthcare journey. And she has not only volunteered her experiences and her data to help open up and prove out that we need to do this for all people so that people like Bailey can have an easier journey than she had. But she's also now pressing the boundaries with her data on advanced genetics and what we call black box genetics that are not yet open for interpretation based on, some mutations that cause her rare disease. So she's saying, look, I want this to be easier for everyone. I want people to be diagnosed faster. I want to create new standards of care. I want to create more precision healthcare and precision medicine because she's on an off-label use of a drug that saved her life. How do we find those things faster so that people don't have to go through what she went through? And I would say she is my inspiration in this role unequivocally every day.
Last question, and this may be already baked into your company, but can you tell us about a charity, cause, or other endeavor that you're passionate about?
Yeah, we do a lot of charity work, and we allow every one of our employees to contribute bonus dollars and bonus points that we award every month to whatever charity of their choosing. We do on-site, kind of field days where we help in different regions where we have offices and locations where we spend time out of the office that is paid in giving back to the communities that we are in. But I would say I'm going to take this another direction and go with a cause. Early in Bailey's journey, I always like to say interoperability nearly took her life. And in her most recent experiences, prior authorization nearly took her life. The science of medicine has so far surpassed the administration of healthcare on these monolithic systems. So a cause that I'm very passionate about and working on internal to the company and external to the company is how we automate, make prior auth real time, make it transparent to consumers, and that we can basically eliminate the majority of prior auths in this country that are not necessary for cost savings and controls. And in her case, being denied life-saving meds because they are quote unquote experimental when they have in fact, saved her life. The scariest thing to me as a mom today is not her disease. It is her changing insurance to reauthorize what is considered experimental medications because it's not FDA approved for her unnamed disease that she doesn't have. So it's really concerning for me. And I don't want to be worried about her every single time she changes roles and jobs as to whether or not we can get her life-saving medication that she will be on forever covered.
Mm-hmm.
And so to me, that is a cause that I'm really passionate about. And I'm working with a lot of organizations across the country who are equivalently as passionate about it. But it's also a major cause for provider burnout and people leaving the system. So it's something that we've got to fix as an industry. But there's real lives attached to that. And so that's something I would say I'm incredibly passionate about right now.
Kristen, I want to thank you again for taking the time. This has been a wonderful conversation.
Absolutely. Thanks so much for having me.